I'm Bruce Marshall. This is the Brampton Now update for the April 17th, 18th weekend 2021. Coming up, confusion. Some say dithering from the province. First this, then that in terms of schools. Then the hammer came down from the Premier on Friday afternoon. Temperatures this weekend just into the double digits with clouds and a chance of rain on Saturday. Full Environment Canada weather details at the link in comments. This is the Brampton Now update. Here's what's happening in Brampton. Playing catch-up now. To raging criticism on social media, extra police powers among the suite of tools brought in by the province, but no paid sick days. Premier Doug Ford is listening to the scientists again, sort of.
So effective immediately, we're extending the emergency declaration and prolonging the stay-at-home order province-wide for an additional 2 weeks, for a total of 6 weeks. Outdoor gatherings will now be strictly limited to members of your own household only. Anyone who lives alone can join with one other household. We'll be closing all non-essential construction. We're restricting all outdoor recreational amenities, such as golf courses, basketball courts, soccer fields, and playgrounds. We're reducing capacity in big box retail even further to 25%. Beginning on Monday, places of worship will be capped at a maximum of 10 people indoors. To get ahead of the variants that are plaguing Western Canada, beginning Monday, we're setting up checkpoints at all interprovincial borders. We'll be limiting access to border crossings between Ontario and the provinces of Manitoba and Quebec.
All this week, though, another confusing, scrambling week for parents. On Sunday, the Education Minister announced that schools would stay open. On Monday, April 12th, Premier Doug Ford shut the front door on schools, probably for the whole school year, leaving Ontarians saying,
"Oh, what fresh hell is this?"
But it's no laughing matter for people looking for clarity from leadership. As of the Wednesday news conference in Brampton, here's the current lay of the land from the chief medic.
Area hospitals are bracing for disaster. All surgeries and pediatric admissions have been cancelled. There are now call-outs for healthcare providers. I myself received one of them to support the significant demands for care that are occurring in the hospital and in ICU and in non-traditional places such as repurposed outpatient clinics like the fracture clinic.
With apologies for the audio quality there, the chief medic says hospitals are bracing for disaster, a place we never should have got to. In Peel, our chief medic has been urging caution and a slow, gradual approach to opening up, which is not what the province did. Here's how we got to the brink of disaster.
So you have to remember the picture we're seeing now is reflecting what we were doing 2 weeks ago, right? And so 2 weeks ago, we were in the process of reopening retail. We had reopened places of worship. We had also reopened outdoor activities, but to the extent that the outdoor, transmission is significantly diminished compared to indoors, I don't think that's what drove it. I think to some extent we just kind of came out of ourselves. There were schools that were opened up and the community around them, and I'm not saying that there was transmission that necessarily occurred at great length through the schools because there were measures in place, but the community was gradually getting bigger and opening up more and more just at the end of March there. I think the end of the March represented the culmination of what was a stepwise reopening throughout March. I for one had advocated trying to remain in gradual measures, gradual reopening, remain in measures for as long as possible. That's what I think deferred most of our wave with the variants starting to take hold, and we didn't necessarily see the significant increase in rise that other jurisdictions in Ontario did from mid-February, where they all had to go back into grey lockdown very quickly away. So we've always had high levels of transmission, and even for us, just even a little small thing, just given how big our population is and where we were always at risk of just taking off again, unfortunately.
In a moment, a week of big numbers. Infection rates through the roof, but so also are vaccination numbers. More on that next on the Brampton Now Update.
Over 120 years ago, the St. John community came together to help disadvantaged boys. Similar organizations popped up across the country and eventually came together as one. Girls needed safe spaces too, and we changed to meet their needs. But not every young person identifies as a boy or a girl, so we've changed our name to reflect that. At BGC, no kid or teen is ever turned away. No matter their background, no matter their circumstances. We are the largest dedicated child and youth-serving organization in the country. Thousands of staff and volunteers nationwide believe that every single kid deserves a vibrant future. This means we will not allow any child or youth in Canada to be deprived of personal opportunity. Every kid faces different barriers, so we do an awful lot to help them. Does our work have impact? Just ask our alumni. We provide systemic opportunity to children and youth. We help them become their best selves. We cheer them on as they take it from there with confidence and conviction. All they need is opportunity, because opportunity changes everything. Now who's with us?
This is the Brampton Now Update. I'm Bruce Marshall. We've ended up with a confusing patchwork of conditions to get the vaccine. It's also been alleged that the provincial government gave preference to some postal codes not because they had high rates of virus, but because they voted Tory. The NDP are asking the Auditor General to look in on that. Meanwhile, Peel's leaders are screaming that the whole region should be one big hotspot rather than this confusing patchwork of postal codes. Mayor Brown says make all of Peel a hotspot. Chief Medic Dr. Lawrence Lowe.
With 25 of 33 neighborhoods and 85% of our population Peel defined as such, it is Peel Public Health's view that all of Peel should be designated as a hotspot for simplicity and consistency in prioritization.
Even Caledon's mayor, Alan Thompson, got in on the Brampton press conference on Wednesday.
We're a hotspot, full stop. Peel is a hotspot, full stop. We need vaccinations, full stop.
One thing that there's no confusion over is that all of our public officials are urging everyone to get a vaccine appointment as soon as possible. I got my first one at Peel's HQ on Thursday. The staff were just absolutely excellent, and I was one of the thousands of vaccinated this week.
We are now vaccinating nearly 100,000 residents a week across all our channels, with a record 12,500 doses in one day delivered this past Saturday at all of our mass clinics.
In a moment, closing words from the authority who never fails. Peel's Chief Medic, Dr. Lawrence Lowe, on the way forward. More on that next on the Brampton Now Update.
Hello, I'm Mayor Patrick Brown, and I am one of the many faces against parental alienation. Being a face against parental alienation means I've joined the fight against domestic violence, child abuse, false allegations, and parental abductions. You too can join the fight and campaign with us by wearing Royal Blue April 25th in support of Parental Alienation Awareness Day so that we can all be a voice for the voiceless.
There are some things you just don't do halfway. Fighting COVID-19 is one of them. As vaccines roll out, let's keep giving this our all and continue to follow public health measures. A message from the Government of Canada.
Canadians are dying of overdoses every day. Stigma is making it harder for people to get help. Addiction is a treatable medical condition, not a choice. Help end the stigma. A message from the Government of Canada.
I'm Bruce Marshall. This is the Brampton Now Update. Dr. Lawrence Lowe, the man with the big asks to keep safe.
So once again, I urge all of our residents, please stay home as much as you are able. Connect virtually and limit contact with those that you do not live with. And if you must meet for an essential reason, always mask, distance, and keep it outdoors. If you are sick, do not meet. Get tested and self-isolate unless you need medical attention. Finally, I call on all of our residents to get vaccinated when your turn comes. In accordance with provincial direction, hospital and community vaccination clinics in Peel can be booked online for all residents aged 60 and over, born 1951 or earlier, or those 50 and over between 1951 and 1961 if they live in a provincially defined hotspot. Our mobile program, which has been in effect since January, also continues and has delivered 10,000 doses as of this date to apartments and other senior settings, shelters, and the homebound in our community. We are excited that with recent announcements, we are now able to expand our mobile offerings into other venues such as community centers and workplaces as pop-ups for all comers over 18 plus.
And that is the Brampton Now Update for this week. Please subscribe to the Brampton Now Update channel on YouTube or follow #MarshallMinute on Facebook. The Brampton Now Update, your weekly reliable source for all things Brampton, unbought and unbiased. Your comments and suggestions are always welcome, and if you've got a Brampton story to tell, get in touch with me through the channel you're watching on right now. Stay strong, Brampton. Brampton strong. We're all in this together. I'm Bruce Marshall. Thanks for watching Brampton Now Update.
Quiet, numbskulls, I'm broadcasting.